Okay, trying to connect it
Must
right
be,
now.
must be going to be good. Satan's on our tail.
You got it. Here we go. Take that. All right. Let's see if I'm on. It says it's live streaming. Checking the book of faces though. Oh, there we are. Good deal. All right. Hello, Limey and Crunchy. Thank you for bearing with us. We just had to overcome some technical difficulties to get with you all tonight, but here we are. I am here with my lovely friend, Erica Hoke, who also happens to have battled and beat infertility. She does not necessarily personally have a Lyme story, but she relates to us on the fact that she is all about holistic wellness like we are. And she is here tonight specifically to share her story and a few kind of testimonies and examples of holistic methods for healing that we can consider using as well. And she has some experience with a few things that I have not gotten to try yet. And so I'm learning from her. And I hope that you all can learn from her as well. So I'm going to let Erica get started with her story so you can get to know her, because she is the most wonderful human. You will love her. Go ahead, Erica, take it away.
Wow, that's a lot to live up to.
I love you.
Depends on what day if I'm a wonderful human or not. So thank you for all of your kind words. We've come to be dear friends, so we can joke with each other like that. But so I'll just cut to the chase. My husband and I met and married later in life, and we knew that we wanted to start a family right away. And it wasn't going to be any mystery to us that we were going to face some fertility issues, because I already knew that I had PCOS. I had something called factor V Leiden, which I'm super passionate about. That was diagnosed when I got a blood clot 2 years prior to us getting married, and or conceiving actually. And then I also had stage 4 endometriosis that I had a pretty extensive surgery for, and had that excised before we got married. And I also had lots of laparoscopic surgeries. I had one for uterine fibroids. One for exploratory, and then one for the removal of the uterine fibroids. And it was really crazy because when the surgeon got in there and did the surgery, he took out so many fibroids. The only thing that I can describe to you is that it looked like a handful of aquarium gravel. It was a crazy amount of a lot of little fibroids all in my uterus. And so we knew that we were going to have struggles and have these challenges to overcome. But in the back of my mind, the whole time, I just thought to myself, well, we've done this, and this, but then if it doesn't work out, we'll do IVF, right? Like, we didn't want to necessarily, but hey, that's our plan B, right? Until we were told that was not a plan B for us. I was already hyperovulating, so any of the medication that they would have given me for egg retrieval was not going to work, because my body was already doing all that work. So we couldn't do egg retrieval. We had less than a 1% chance of conceiving when I was 35. And we just felt like the odds for IUI were just not worth it for us. Like, we didn't feel good about it. Like, we didn't feel good about anything surrounding IUI is all I could say. Like, with everything that was going on with my uterus, with the scarring, everything with my husband's plumbing was good. And so we just didn't want to go down that path. And so I started just researching like crazy all the ways what affects your fertility. What can you do within yourself? What do you have control of? What are natural ways to support your fertility? What affects your fertility? And that led us to acupuncture, which I really credit quite a bit with helping us for a lot of different reasons, some of them not all physical. But acupuncture helped a lot. And I know you want to ask me some questions about that, but then just started making major changes to my lifestyle and my diet. By the way, I'm gonna do a spoiler alert here. I have 4 very active boys. Okay. So the end result was we did get the family of our dreams, and the things that I was able to implement helped my body, and got it into a place where I could conceive. So
Awesome. That's amazing. Yes.
yeah.
I can attest. I've seen her 4 active boys. They're awesome. And it is a very cool, like, success story and like redemption story. It's just so neat what you've been able to accomplish. Of course, like in this and all things that I do on this page, like my disclaimer is always the same. And I know Erica agrees that we're not here to treat, diagnose, cure, or claim like any magical miracles from things, but we're here to give you ideas of things that at least you might be able to try to see how they impact your health and wellness journey. If they can make such big differences in the fertility of somebody that is, you know, higher risk for having issues, or maybe not even being able to have children, and then they show up with 4 kids later, you know, that's a pretty significant change in health and wellness, you know, and all from natural, like holistic kinds of options that are out there, alternative therapies that are out there. So Erica, we talked about maybe sharing 3 of the main things that you have done over the years, some in the past, some you've continued, some more recent, to kind of highlight. Hi, dude. I have a visitor. Speaking of babies. To highlight some of the things that, here, say hi.
Hi.
So good.
Hi.
And then we can highlight some of the things that you've done. All right. Can you say bye-bye? Night-night. Night-night.
Bye-bye.
All right, go
Those
to bed now, Dad. Milk.
Yeah.
All right, guys.
Hashtag
Sorry.
mom life, right? Yeah.
Totally. It's a bedtime hustle over here, which there they go with Dad. So, all right. Anyway, let's start with whatever you want to start talking about. If you want to go on with the acupuncture story, because I really like that one, you can start there, or whatever you think is pertinent to start with.
Yeah, so sure. Acupuncture, I think helps a lot of people with things in their body that Western medicine have a hard time addressing. So for me, my cycle is regular.
Yeah.
So that wasn't a problem, but I had a really dear friend who used my same doctor because her cycle wasn't regular. And she, within 3 months, was able to get her cycle regulated. And on month 4, she conceived. So things like that, where Western medicine just kind of throws their hands up in the air and they go, we can't give you a pill for it. I don't know what to do. Your cycle's not regular, or you end up on some really harsh fertility drugs. And in my case, I really believe, hindsight is 2020, but I know that I was being led to the things that would help my body, because I did not find out until after I was done having my children a few years ago that I have MTHFR. So there's 2 genes. I'm not going to go really far down this rabbit hole, but I want to mention it because overall, globally, for holistic health, this is really important to take into consideration. So there's 2 genes for MTHFR. There's 2 pairs on each gene. I have all 4. Right. So that's another topic for another day, but it affects how your body processes medicine. It affects how your hormones are balanced. It affects how much your body can detox and things like that. So back to acupuncture. So the things that acupuncture can help with are psychoregulations. Prior to having my endometriosis surgery, it was helping me with pain management and also with flow, which was pretty much almost uncontrollable to the point that I had a hard time working. It was just almost unmanageable. And then, so how does that work? How does like I'm just a layman, like just trying to explain to you how acupuncture works. But the basis of it is that you have meridians in your body, and those different points, and you've heard of pressure too, correspond to different organs in your body. So by stimulating or applying the needles to those points, you can help your liver, say, detox and things like that. Your liver and your kidneys are governors of your fertility. And so by helping support those organs, you therefore help support your hormones and help support your fertility, if that makes sense. And in my case, again, I didn't know, but it was also helping those organs detox and just helping my body overall detox by stimulating some of those points in my body, like my lymphatic system and things like that, so that I was processing hormones a little bit better, like just the very basic thing, like take out the fact that it was helping me process toxins because I wasn't toxin free yet and things like that. It was just supporting my body in that way. And I have to say this because many, many times when I mention acupuncture to people, they're like, I would never, that seems like the weirdest thing. And it seems like it's super painful. And I will tell you, I was deathly afraid of needles, like deathly afraid of needles before I started getting acupuncture, but I was darn determined to have a baby. And so I was willing to try it. And honestly, like people really equate it with having a shot or having an IV or having their blood drawn. And it is absolutely 100% nothing like that. No comparison whatsoever. Now, does that mean that it's pain-free? Not entirely. But the needles are smaller than a human hair. And so some points hurt worse than others, so sometimes it's a little stingy, not like a bee sting, not like a shot, but in a different way. It's a little uncomfortable, but it's a very, very, very fine needle. So
perfect. Good information.
Yeah. Yeah.
Yeah. It's kind of frightening to think about all those, like being a pincushion, right? And having that all stick out of you. But it's a really good point that like our whole body is so interconnected, and we can actually reach deep inside just from some like topical application in specific ways, in the form of acupuncture being one way. So that's really neat. Actually, I just learned a bunch of stuff that like I didn't realize it could help with. So that's very cool. I might be trying to find an acupuncturist here soon.
Yeah.
I love it. Yeah. And I know that this group, I like that you mentioned pain management, because this group in the Lyme world, as you know, pain is pretty much everybody's symptom, to some degree, differing degrees, but a lot of people are looking for much better pain management, and you can only take so many meds, and they only are so effective, and they come with so many side effects. I don't know. I mean, this question might put you on the spot. Do you know of any side effects of acupuncture? Like, I don't think there are any.
I don't know of any side effects. No.
Yeah. Yeah. So that's just kind of a cool option to have on the table for some people. So I also know that along the way that you have worked a lot on your mindset and your mental health in general. And one of the things that I wanted to hear from you more about, if you don't mind, is specifically neurofeedback. Again, this comes up in the Lyme community a lot too, as a possible therapeutic method, but you have actually done it. And so I'd love to hear what you think about it.
Yeah. So I'll do my best to tell you. So the basis of neurofeedback is that you have disruption in your brain, either from a traumatic brain injury, from an impact injury, something that you may or may not know. Also things like, my practitioner is actually seeing a lot of people with COVID brain, is what he's calling it, where they're, people are having headaches or like lingering headaches, lingering symptoms, headaches, memory loss, and disruption, dis-ease in the brain, right? That's what we're talking about, like overall, overall. So, sorry. I was going to say something else and I forgot. But so Lyme also, he does treat Lyme patients as well, which I didn't even realize until I started seeing him. And then Adele and I started talking, and I don't know if you had heard that. Had you heard that neurofeedback helps with Lyme prior to that?
Um, I heard about it, yeah, like in like forums and group settings, not specifically from like my doctor or anything like
Right.
that. But I, indirectly also, I'll just say this for anyone, if it helps anyone else out. Indirectly, I heard about it through a counseling center that we actually used for our daughter's anxiety. It's called, like, the name neurofeedback is in the title, the name of the counseling center, neurofeedback counseling center of where, the town I'm in. And I was like, huh, like it just kept popping up in my life, kind of. So it is big in the Lyme community, but I know it's used in like all kinds of situations. So it makes sense because Lyme has huge neurological impacts. So if you're addressing the neuro system, that seems to make sense to me.
Yeah. So we're going to give you a buffet of topics tonight, I think. And so this will be choose your next adventure. So I'll just mention some of the reasons that I'm using neurofeedback myself and how I came to this point. And like I mentioned, MTHFR. And if you want more information about that, we can talk about that later. And Adele's very versed in that too. So I have a history of sexual abuse and trauma. And that was part of my infertility journey as well, was addressing some of that, both emotionally. The acupuncture also can help with that. Trauma is stored in our body. And I don't think that it's any coincidence that, or any lack of the causation correlation thing, that 1 in 6 women are victims of abuse. And then that's also the same infertility rate, is 1 in 6 women will experience infertility. And I definitely think that there, based on my research, is a connection with that. So I had addressed a lot of that through talk therapy, of course, acupuncture. I use essential oils for that. I also use CBD for that. But there comes a point as you get older and older where the longer something goes unaddressed, the more acute that it gets. And that's kind of been the case for me, that those things were working up until a point, and that point stopped or was less effective than I wanted it to be. So that's kind of what led me to the neurofeedback. But my son is also doing it with me too. So it helps with depression. It helps with kids that are, he does not have an official diagnosis, but he's got a disconnect. Let's just say that he's got a traumatic brain injury, basically from a vaccine injury. And so he's got like some neurological disconnect. And for him, it was a fast alpha wave. So I'm going to start saying a lot of waves. I don't know what they all do, but I'll just tell you the few that I know. But it's like, for him, he is in fast idle all the time. So he's kind of got like a racing brain. So what the purpose of neurofeedback is to bring all of your waves into synchronicity. So there's alpha, there's delta, there's theta, there's beta, there's high and low beta. I think that there's around between 10 and 13 different brain waves. And so it helps to, I'll tell you how, but the goal is to bring all those into synchronicity so that the brain can, the right lobe and left lobe can correspond and speak to each other, communicate correctly together. So how is that? How do you do that? They do brain mapping. And so the brain mapping is a cap, kind of like what you would imagine, like with all the wires coming out. So the electrodes are on the inside, and there's nothing necessarily attached directly to your scalp. So it's not invasive. There's no like little, it's not needles or anything. But you have electrodes attached to your scalp through a gel. And then they do mapping, and I'm trying to remember exactly how it went, but you do it with your eyes closed because it picks up on eye movement. And then you do it with your eyes open, focusing on a visualization. So a picture, a video, something like that. So they can audit out all the extraneous noise, background noise that your brain picks up on, like we're talking, you hear your baby in the background, or you hear people outside the door in the office talking or whatever. So they do the eyes open and eyes closed so that they can map the brain correctly and see what's what, and decipher what's what. And then like in my son's case, this is really a cool thing. I think you'll get it. So I feel like it's a little bit hard to explain, but he has certain electrodes attached to him, and then he watches a movie. Now it can be any movie. And when his brain focuses, so the electrodes are hooked to the fast rotating waves, right? So we want to bring them in synchronicity. So when he focuses and it brings them into synchronicity, the screen is full screen on the TV. When he goes out of focus and it goes out of synchronicity, it shrinks down to like, a quarter of the size of the screen. So you'll see it expand and contract, expand and contract. And it's literally like exercise where you're building muscle memory in your brain. So we're building his neuron connections. I'm starting to feel nerdy talking about this, just so you know. And I see you have some questions. So anyway, that's how they're treating him. Now my treatment's a little bit different, but I'm going to pause here and see what questions you have. And then I'll tell you what my treatment looks like. So
it's all good. I was just listening and not even looking at the comments. Okay. So I'm checking the comment questions. We might have to backtrack to what you mentioned before, but Carol is asking, and hi, Carol, by the way, have you seen silver helping, the colloidal silver helping you? And she's also asking at the same time about ionic magnesium and iodine. So if you could just backtrack to thyroid health briefly, do you have any comments on any of that off the top of your head?
I don't. I actually didn't mention, I do have, I think I didn't mention about my thyroid. Maybe I did, but I can't really speak. Yeah. Sorry, Carol, I can't really speak to that. I do use colloidal silver for the antibacterial properties and for immune support, but I know Adele and I had talked about having a conversation about thyroid ranges and advocating for yourself in the thyroid community. But as far as the supplements, sorry, that's not an area I can speak to.
Yeah.
I do highly recommend though, the Anthony Williams book, The Medical Medium, if you're familiar with him, on thyroid health. That is something that has helped me tremendously postpartum, postnatal.
Awesome. Yeah, Carol, if you have specific things that came to mind related to what you were asking about all those supplements you mentioned, like feel free to comment again and I'll watch the comments for that, because maybe we can answer more specifically to what you're asking, just from what we know. I'm not even sure I know about ionic magnesium specifically, but I do take a lot of magnesium myself.
Yeah, me too.
Yeah, it's good stuff for a lot of body function and sleep and all the things, mood.
Yeah.
But the last question here from Carol also is, how do I get neurofeedback? Is there like a database or a website search or something you can do? Like, what's a good way to find a reputable provider for that?
Yeah, I will drop a link. I don't have it like right at my fingertips right now, but there is a national registry and there is, there's their MDs. And so, no, you're fine. We're getting our own feedback.
Yeah, I'm trying to turn my media off. Go ahead, because I can't see the comments.
Yeah.
I can't see all of them. So go ahead. I'm still watching the comments.
No, that's okay. I can drop that in. I can drop that link. There's a lot of providers.
Okay, awesome. Thank you. Yes, we'll get that put in the description, the video description or whatever. Carol also said, I've got comments like in 2 different places, so I am sorry, guys. Can this help with dementia or ALS? I'm assuming she meant for ALZ or Alzheimer's. Okay, sorry.
Okay.
You know about how like neurofeedback, I would think, would possibly be helpful, right? Like, do you agree?
I think that it has the potential, to help with that. I
Might
haven't looked
depend
into
on how
that
far along it
specifically.
is.
Right.
Yeah.
Yeah.
Right. Okay. Worth trying, worth asking about,
Yeah.
right?
Yeah, for sure.
Ozone also, she was just mentioning, I don't think it's a question. I think she's just throwing ozone therapy out there.
Ozone.
That
Yeah.
is common in the Lyme community. Have you done ozone therapy? I have not yet.
I have not. Mm-mm.
Yeah. So
No.
if anyone else watches this and has and wants to talk about it, let me know.
Yeah. Yeah.
Um, so anything else with the neurofeedback that you wanted to share with us? Because we got
Yeah.
sidetracked by those questions and
So I'm a person that just like likes to know what to expect. So I'm just trying to give you an idea of like what my therapy is like versus my son's. So he's treating me for my CPTSD, and my treatment looks a lot different than my son's. And so we have passive treatment for me, which is a little bit different, where he's stimulating different parts of my brain with the electrodes. So that's the passive therapy, and that lasts somewhere around 15 minutes. Again, not painful, non-invasive, just moving the electrodes around and then stimulating at a very low frequency. And then the active treatment has to do with binaural beats.
yes.
So I've got, yeah. So I've got,
I just talked about that today on my sleep video that I did earlier today, guys.
Right.
Binaural beats, man.
Yeah.
Go ahead.
So it's binaural beats. You can Google that. And yep, it's good for sleep. And so I've got the headphones on, and then he's got some glasses on me that have depending on what's going on that day, it's different colored lights. I have some shoulder pain. I have a feeling I've got a little fibromyalgia going on in my shoulder. And so that day it was really bothering me. So he used a green light. And at the end of that, again, for pain therapy, it was a tremendous relief. So depending on what's going on, what we're treating, but the main way the active treatment works is that you recall your PTSD trauma, and he dials into a frequency. So it's a little hard to explain, but when you're, so I'm listening to something, and then when I'm accessing the mental picture of the trauma, and then the frequency is gets more intense, then that's the right frequency. Okay. So
Right.
we know that that's the frequency that the trauma is on. And so then he adds a disruptor to that. So then I sit and listen to that. So the frequency that causes the most discomfort, then he's adding a frequency that interrupts that, so that you are not, you're retraining that pathway, right? The record's going round and round. That groove is in your brain at that frequency for that memory. So we're bringing in a different sound to disrupt that. So I don't know if that sounds woo-woo to anybody, but that's how it works. That's what we're doing. So
It's very cool to me. Honestly, my holistic health provider that I do my Zytoscans through, she actually like messed up. I believe in divine timing, but she clicked the wrong button during my Zytoscan and added frequencies to my scan results, which she doesn't typically do. She typically limits the scan results to like more
supplements,
tangible,
food.
more tangible things, right? Than frequencies. But I found it very interesting, and we actually landed on I actually came up for 2 frequencies needed for balancing, and one of them was associated with mold, Lyme, and candida. Specifically, like when you like Googled that exact frequency. So and the other one was I can't remember off the top of my head. I'd have to look it up, but it was like 47 hertz or something like that. That I'm supposed to listen to for 15 minutes twice a day. And it must have something to do. So she's not making the connection with disrupting that pathway, but I'm curious now, like what that would look like if I took that to a neurofeedback level to see what that means about what's going on in my body from past trauma or from illness or from, healing, whatever that looks like. So I think it's very cool that is part of the treatment, because it's just one piece of what, like, frequency is one piece of what makes us function. And if that is, associated with our healing, we should be looking at it. right?
Yeah. Yeah,
Very neat.
absolutely. Yeah.
That was a great explanation. I feel so much more comfortable like understanding it now. So thank you.
Yeah.
Cool.
And I think that there's different ways. And, you know, keep in mind if you've got kids, like we have such a broad group in here, you know, and so if you've got kids that have ADHD, if you suffer
Right.
from anxiety or depression,
Right.
these are things that all of these things are going to help. So
Right.
the bottom line, the acupuncture and the neurofeedback are both working on frequency and meridians in your body, just in different ways, right?
Right.
We're accessing that in different ways.
Exactly. Exactly. That's a
And
really
I
good.
do want to, sorry.
No, go. Talk.
No, I don't want to forget, because I feel like if you're a mom out there, this is going to be an infomercial for you.
Yeah.
Forget the massage. Go find a float tank, right? So
Yes. I wanted you to talk to us about float tanks. So go right ahead, because this thing blew my mind, y'all. You want to hear about float tanks. Trust me.
Yeah. First of all, just so you know, I was like, I'm not getting in that thing and shutting the lid. I'm not going to do it. And I think Adele even said to me, do you have to close the lid? And I was like, I'm not closing the lid.
It scared me just seeing this little pod. Yeah.
Okay. First of all, it's huge. Like the pod. So what a float tank is it's a let's say it's a private chamber. It's not a pea pod. It's a private chamber. And it's full of warm water and a ton of magnesium. So you float. So if you have pain issues, first of all, magnesium is amazing. Most people are super, super deficient in magnesium, especially if you're still eating dairy. I have an awesome article on that. Again, I'm not going to go down that rabbit hole, but we can talk in a minute. But so you get in and you float, you shower off because you want to get all the oils off your body. You're going to get your hair wet. I'm just telling you what to expect, because I like to know what to expect.
That's right.
And you get in. If you don't feel comfortable, like you have your own private room, you know, it's like a private massage space, but it's a whole room. It's a big thing. It's a big apparatus. It's probably 3 bathtub sizes, like 3 big bathtub sizes wide, like 4 for a standard bathtub, like 3 for an oversized bathtub. It's big enough for you to float, not just lay, you know, in the like lay in the water like this. And so it's warm. And if you want to stay warm, which I hate being cold, you close the lid. And so you've got an inside, it doesn't lock or whatever. You've got an inside handle. There's lights. You have a lot of control over it, in case you're like me.
Neat.
And then you just float. So it's a sensory deprivation tank is what it is. And I don't know any mom that doesn't say once a day, I just want 5 minutes alone, like with no noise, right? And so this is a full hour, praise Jesus, this is a full hour of no one touching you and no one talking to you and no stimulation. And so for me, that was an amazing thing, because I had a little light bulb moment, because when you go and have a massage, yes, it's relaxing, but somebody's touching you and it's stimulating. And so that comes with its own neurological load implication. Like for me, with my MTHFR, I cannot do anything but a 60-minute massage, because I get a toxin flush from that. And if I do a 90-minute massage, I throw up afterwards. Like I can't drive after my massage. So
it can be intense. Yeah.
It doesn't take much for me. So this float tank was an amazing thing to find. I plan on doing it again very soon. Very, very relaxing. And the magnesium is awesome for your body. So
yes. That is so cool. I didn't even know this existed until you did one. And now, so Carol, it looks like, has done a float tank before. Carol is like on the ball. She's done a
Carol's
lot of
on it. Yeah.
Yeah, I know. That's awesome. So anyway, I'm new to it. I don't know if there's one in my area or not, but I love the idea now that I've realized it's not like some kind of claustrophobic little pod.
Yeah. You can sit up on it. You can sit up in it, like,
awesome.
Yeah. It's
that's really cool.
it's roomy.
Perfect. That's what I need, man. That's what I need.
Spacious.
Yeah, I love that. I love that. So, unless I'm watching the comments too, unless someone has a comment or question specifically about either what Erica's talked about or any other, like, we're getting a lot of different kinds of comments. I'm going to have to go back and respond to them after this wraps up, because like someone asking about the name of mold testing, I got to go look it up. I don't remember.
Yeah.
But yes, there is time for comments and questions if you have any specific for Erica. And she's done other alternative therapies too, but we tried to pick the ones that were super interesting, most different, and maybe hadn't been tried yet by our Lyme community. So I'm just watching the comments really quickly. But Erica, what was your favorite? This is my question. What was your favorite? If you had to pick one of those things to do as a priority, what do you think the choice that would be?
I think at different stages, I meant to mention this when I was talking about the float pod.
Mm-hmm.
When I was leaving the other day, I ran into somebody and they said, "Oh gosh, when I was pregnant, I wish I had known about this float pod." I mean, all the pressure on your body when you're pregnant. Somebody that has like a lot of physical pain, like, I think would really, really benefit from the float pods. If you're suffering from fibromyalgia, if you have a lot of muscle, I think somebody asked about ALS, maybe, or was that Alzheimer's? But, people can really benefit from that.
Yeah.
For me, I had gotten into a point with my traditional talk therapy that I needed to move, beyond that. It was physiological. By the way, it turned out, and I grew up riding horses, so who knows when it happened. I mean, I fell off a few times. I fell roller skating a bunch when I was a kid, but I have a moderate to severe traumatic brain injury that I've probably dealt with and compensated for maybe a good deal of my life. So that was interesting to find out. So I don't know that I could prioritize one, because each of them has served such a purpose in my life at the time that I needed it. And that's how we learn and grow. Like, just keep trying to do the things that your body needs. Right. So try the new thing, see if it works. None of them haven't worked for me. Let's just say that, the acupuncture was integral for my conception. Gotcha. And now these things are in this stage of my life, are going to be integral to allow me to move forward and be able to, take that next step. Sorry if my video just cut out.
No, you're good. You're good. We still hear you. So it's all good. That's awesome. I really appreciate your time because I know the Lyme community is desperate for answers sometimes, and often will look into whatever could possibly be a lead for them. So I just want to provide them options of things to try. So thank you so much, Erica, for your time. We will get links and whatnot into the comments as I get them. I will edit this for that. This video will also live in our unit section where we have all the other interviews stored. So you can always find it there quickly if you want to reference it again. And I will save it on YouTube as well, because I do that too. So everyone can find it. So tag your friends if you think that they will find this beneficial as well. And thank you again, Erica. I hope you guys all have a lovely evening, and we will possibly be having Erica back. Stay tuned for another set of topics in the female health world, y'all, because I know some of you have been asking for that too. So keep your eye open for more Erica.
Bye, guys.
All right, everyone. Have a good night. Bye-bye.